I want to start off by making it clear that we're really talking about two separate disease processes right now. The first is a process of the spread of COVID-19 through the general community. The second is the spread of COVID-19 through long-term care homes and other congregate settings. And I'm going to take some effort to try to distinguish the dynamics of the disease in both of those different settings. So if you remember the earlier discussions, you would have known that our models were predicting a peak of cases in May, a peak of new cases in May. The public health interventions, both large and small, both physical distancing, a very significant sacrifice that people make, the stay-at-home or shelter-at-home instructions, a very big sacrifice, but also smaller things like hand hygiene, keeping surfaces clean, those sorts of issues. That has actually accelerated the peak to now, and so that we're looking for, regardless of the model we use, we're looking at a peak that is right now for the community transmission of COVID-19. Now, peak is important because epidemics follow what's called Farr's law, which means that they essentially have a symmetrical shape. And so as you come up, you peak, and then hopefully cases diminish down the other side of it. And so that's important when we talk about peak, to make it clear that we're now hoping to see a reduction in cases as we go along. Peaks are not a single day. Peaks are not sort of a nice single sort of spike. They can be a little bit bumpy. They can prolong for a period of time, particularly given public health interventions. But we're in that peak period right now. Think back to the earlier presentation where we talked about the expectations of cases under different scenarios. The worst case had been about 300,000 cases. At that point, a couple of weeks ago, we've been thinking about 80,000 cases in April as the expected number of cases. We're now looking at a much lower number, hopefully under 20,000 cases in this wave of the pandemic. And so this means that if you think back to sort of our best and worst cases, we're starting in terms of our cases to look more like the best case. However, it's difficult to draw conclusions on mortality right now because of these separate disease processes. Mortality from community-based transmission we expect is coming down, and we expect that we're going to see a lower number of overall deaths. But the ramp-up of cases in long-term care homes, the mortality that follows on that obviously makes it hard to predict a number of actual deaths. And so, if you sort of kind of want to summarize these disease processes, we're at peak in the community, but we are still on that accelerating upswing of the curve right now in long-term care homes. And I want to make it clear that when we talk about long-term care homes, we're really talking about any congregate setting, so that could be long-term care homes, that could be homeless shelters, it could be any place where a lot of people are brought close together for prolonged periods of time.